Hello everybody, I'm Dr. Xiao Yiling of the ClearSK group of clinics. So today I'll be talking about a very popular topic of concern is dark eye circle. So as we now know, dark circle is actually very common. A study in 2015 actually shows that the eye circle occurs as early as 24 years old. So dark eye circles can run in family, and these are due to genetic reasons. For others, it is due to their lifestyle like long screen time, not enough sleep, smoking, as well as alcoholism. So the causes will help us to decide which treatment is suitable and how effective it will be. There are broadly four main types of causes, and they are classified by the Woods lamp as well as using an ultrasonic tool. So you have the P-type, which is due to pigmentations or collection of melanin around the eyes, and typically this is associated also with pigmentation near the eyes area. Then we have the V-type or the vascular type of the eye circle. This is due to the blood vessel that is seen around the skin of the eyes, and they can have a bluish or purplish hue. The next will be the S type of the eye circle, or we call the structural type of the eye circles. These are usually from people with Indian or African origin. Due to their bone structure, they can have a more obvious dark eye circle due to protruding eyeballs, sunkenness around the eyes, and also their genetic tendencies to have more melanin production. Of course, the fourth type is a mixed of all three causes, the pigmentation, the V for vascular, as well as the S for structural reasons. How does dark eye circle comes about? So there are multiple causes for dark eye circle. Firstly, is due to the thinning of the skin around the eyes. So typically the skin around the eyes is 1/3 to 1/4 the thickness of the skin around the face. So therefore there is a lack of elastin, connective tissues and collagen of the skin around the eyes. So people with collagen loss due to lack of sleep, smoking or drinking tends to also have more obvious dark eye circle. Next, there's also a lack of lymphatic tissues around the eyes. Therefore, the eyes will tend to get puffiness, water retention, and so on. Thirdly, the skin of the eyes is very thin, so therefore the blood vessels or micro vessels are very visible under the thin skin, and they can be seen as a bluish, purplish, or reddish hues. It is found that people with anemia or iron deficiency tends to have worse the eye circle, which will get better once your anemia is treated. Inflammation is also a cause of pigmentation around the eyes, causing the eye circle. This is especially so for people with allergies like hay fever or skin allergy, causing them to suffer itch, and in turn they rub their eyes, causing this condition called PIH or post-inflammatory hyperpigmentation. Once we understand the causes of the eye circle, we can take steps ourselves to improve the dark eye circles that we have. For instance, having enough rest or enough sleep, avoid too long screen time so that the skin will be so strained and tired, avoiding smoking as well as alcohol. Naturally, do not rub your eyes if you feel itch, as that can cause injury and then PIH around the eyes. Okay, there are medical treatments available for dark eye circles. Firstly, we have what we call energy treatments. Lasers is one of the energy treatment that can be used to treat the eye circle. For instance, pico laser with collagen settings like pico bright lasers can be used to lighten the rings of pigmentation around the eyes, as well as to stimulate collagen repair of the skin around the eyes. Next is Photoner Eye Smooth treatment, which also use the erbium YAG collagen lasers to stimulate the collagen around the eyes, improving the dark eye circle, the thinning of the skin, as well as fine lines around the eyes. Next, Thermage eyelids uses a small tip that can penetrate up to 0.6 to 0.8 millimeter of the skin around the eyes, and this will stimulate the collagen around the eyes to reduce wrinkles, dark eye circle, as well as puffiness around the eyes. Injectables are now very popular as a treatment for dark eye circles, and these injectables can include hyaluronic acid, which is a hydrating molecule introduced to the skin around the eyes to make it more plumped up and more hydrated to improve fine lines. Then you also have the new generation skin boosters products like a PDRN, for instance, the brand Rejuran Intense, which is designed for the eyes. We also have new generation skin boosters like Sunicos, which consists of hyaluronic acid combined with 5 types of amino acids to improve the collagen of the skin around the eyes. Fillers are thicker, more dense hyaluronic acid which can be injected into the lower eyelid of the eyes to improve tear trough, sunkenness that can make the dark eye circle looks a lot better. A combination of energy treatments, injectables, and fillers can give even better results when combined together.